This lesson is about sinus rhythm. In a normal heart, the SA node is the primary pacemaker of the heart. And it sends an electrical impulse that's spread across the electrical conduction system that causes atrial depolarization, which produces a positive deflection on the ECG tracing we call a P wave. Travels down through the AV node where it's slightly delayed, down through the bundle of His, down through the bundle branches, causing ventricular depolarization and your QRS. And then, of course, repolarization. And this is the normal rhythm for a normal heart. This is repeated. After repolarization is depolarization again. And this is the normal rhythm for your heart. Now, the SA node is the primary pacemaker, and it paces the heart in a regular way between 60 to 100 beats per minute. That's what's expected to be normal. Now, sinus rhythm also has a regular R to R interval, and it's regular because those cells we talked about, those pacemaker cells have sodium and calcium, right, rushing into those cells at a pretty regular rate. Unless it's modified by your body, those cells reach that state of depolarization about the same time every time. And so it produces a regular rhythm. So your R to Rs should be pretty much evenly spaced. You have a P wave for every QRS, so there's a 1-to-1 ratio. So I have one P wave for every one QRS. And that makes sense because atrial depolarization and contraction occur first, and then ventricular contraction every time. The PR is expected to be 0.12 to 0.20. So from the beginning of the P wave to the beginning of the QRS is 0.12 to 0.20 seconds. And that's measuring that delay through the AV node we talked about that allows time for adequate ventricular refill. The QRS is between 0.06 and 0.10 seconds. That's the duration of the QRS. And then the QT is expected to be between 0.36 and 0.44 seconds. If all this criteria is met, then you can say the patient is in normal sinus rhythm. Here's an example of a rhythm strip with sinus rhythm. And you can see on the strip, the heart rate is already calculated for you. It says it's 82 beats per minute. There is one P wave for every one QRS. The rhythm is regular. There's even spacing between R to Rs. And this is normal sinus rhythm. Now, you can also have sinus tachycardia. If your cardiac needs increase, your heart might need to increase production and then speed up to pump more blood more rapidly. So if your heart rate is greater than 100 beats per minute, we call that sinus tachycardia. Now, all the other things remain the same. Your regularity should be the same. It should be regular. You should also have one P wave for every QRS. PR is expected to be the same. QRS should not change. The only thing that really does change about measurements related to rate is the QT interval. The QT interval tends to shorten with increases in heart rate. So if maybe your patient was 60 beats per minute at 8 a.m. and now maybe they're 115, you might see that QT shorten as the rate gets faster. Here's an example of sinus tachycardia. You still see 1 P wave for every 1 QRS. Rate's still regular. Heart rate is calculated for you at 123 beats per minute. And you can see here's the end of the T wave. There's the QT interval right there. Okay, sinus bradycardia, that's when your heart rate is less than 60 beats per minute. R to R still regular, still a P wave for every QRS. PR is between 0.12 to 0.20. QRS 0.06 to 0.10. All that should be unchanged. Now, conversely with sinus bradycardia, you might see lengthening of the QT. So instead of your patient being at 100 beats per minute here, if they slow down to, say, 50 beats per minute, you might see that QT get longer. Now, to compensate for this, we also do a QTC measurement, which also takes into consideration your R to R length and your rate. So it's a corrected QT is what that is. And so if you're doing a QT measurement to see if your patient's QT has gotten longer, you can do a QTC, and it will compensate for those rate changes. And here's sinus bradycardia. Still 1 P wave for every 1 QRS. R to Rs are regular. Heart rhythm 54 beats per minute. Sinus arrhythmia. Sinus arrhythmia is broadly defined as any regular sinus rhythm. Commonly, sinus arrhythmia is usually thought of as respiratory related, or you could refer to that as respiratory sinus arrhythmia. The SA node usually paces regularly. However, there are nerves that control how fast or slow those cells will pace. The vagus nerve, for example, can be impacted by your breathing patterns. So if that nerve is impacted by your breathing, you can have fluctuations in heart rate, because that electrical signal that your body is sending to the SA node to tell your heart how fast or slow to pace is being impacted, and you can have alterations in the rhythm pattern that correspond to respiratory rate. So when you inhale, you might see an increase in heart rhythm, and then when you exhale, you could see a decrease in heart rhythm. And it might look something like this. So if I'm inhaling and then exhaling and then inhaling and then exhaling, would get slower again. So that is this cyclical pattern of breathing is influencing your heart rate or your heart rhythm, because it's impacting the nerves that tell your SA node how fast or slow to pace. So when we're talking about sinus arrhythmia, or specifically respiratory sinus arrhythmia, the two things that are important to recognize about this is the pattern of irregularity, that cyclical pattern of faster and slower and faster and slower, as well as the morphology or shape of the P waves. And we'll get into why that's important later, but those are the two characteristics of sinus arrhythmia that are important to remember, is that cyclical pattern of regularity and the shape of the P wave should all be the same. And here's an example of sinus arrhythmia. You can see here the R to Rs get longer and longer, and then they gradually begin to get a little shorter again. But the P waves look the same for each one of these. Those are the two important things to recognize about sinus arrhythmia. Sinus exit block. Sinus exit block is when the cells of the SA node are blocked internally and it prevents a heartbeat from occurring. I'm just going to give you an example here. This is drawn in green here. This is the action potentials of those pacemaker cells. Okay? This shows that those cells are creating electrical impulse. Well, each time that happens, the SA node sends that electrical impulse across the atria, and it produces a heartbeat. First the P wave, and then QRS as it spreads down through the ventricles, and so on. So every time these cells create this electrical impulse, it causes a P, QRS, and T wave, which represents your heart beating. Well, let's say that electrical impulse was blocked from exiting the SA node. We'll say that electrical impulse was blocked and it could not do that. Well, what's going to happen is when that electrical impulse occurs and it's blocked and it can't escape into the atria to cause that depolarization, so it gets blocked, what's going to happen? Well, it's not going to produce anything, right? Because it can't depolarize those tissues if it can't escape. So you get nothing. Now, those cells did technically depolarize, and so that atrial timing persists, and the next heartbeat falls right on cue. So the next P wave falls right on time. And with sinus exit block, what you end up with is exactly one heartbeat missing. Should be a heartbeat there, and it's not. And all of these P waves will map out just as they should, with the exception of one blank space, one slight pause that you'll see. And this is sinus exit block. Here's an example of sinus exit block. You can see these R to R waves all map out, and you expect another one to be right there, but it's missing. So it's like you erased one heartbeat. All the QRSs map out, there's just one missing. Now that is a little different than sinus arrest. Sinus, the cause is different. The result ends up looking the same. Now sinus arrest, if something is in arrest, it's not doing anything. So what we're saying with sinus arrest is that there is no activity from the SA node. It's not pacing. And here again is the action potentials of the SA node. Each time those cells reach depolarization, it causes a P wave and a QRS. And then nothing until the SA node starts pacing again. So sinus arrest is not a result of the impulses being blocked, it's that they never occurred in the first place. Now, how do you tell this based on, because on the ECG tracing, you don't see the pacemaker action potentials like this. So how would you tell? Well, in sinus exit block, you're missing exactly one complex. So each one of these, you would see exactly one missing. And the rest should map out. But that's not what we find in sinus arrest. The pause here between R to Rs is of an indefinite length. It's not a multiple of R to Rs. It's not like there's just one complex missing. It's just an indefinite length. And here's an example of sinus arrest. As you can see, there's no P waves or anything. It's easier to see their P waves down here. No P waves until right there. And this is not going to be a multiple of the R to R intervals. And that concludes sinus rhythm.